On average, half of all people who receive psychiatric medication for their psychological problems discontinue their medication, either from the beginning or midway through the treatment process. But what are the main reasons for not adhering to psychiatric medication? What factors overpower the desire to heal from a psychological issue? In this video, we learn about various reasons that discourage people from continuing with medication. To do so, let's first delve into the stories of a few of these individuals. Julie woke up in the morning and glanced at the strands of hair left on her pillow. She looked at the roots of her hair in the mirror. Tears welled up, and she wondered why she had to face so much trouble. She picked up her phone and called the clinic. "Hello? I want to cancel my appointment with Dr. Kelleci." She hung up the phone and went to the medicine drawer, searching for the pills that Dr. Kelleci had prescribed for her anxiety and depression 10 days ago. She found the box, and as tears streamed down her face, poured all the pills into the toilet and immediately flushed it. She thought to herself, "I made a mistake from the beginning. I knew nothing could help me with my condition." She regretted taking the advice of her friend to finally seek an appointment with a psychiatrist after a long time. Now, after 10 days, not only did she feel depressed, but her hair had also started to fall out. She despised herself and regretted trusting people once again. A few blocks away, members of her family had gathered to discuss their father's situation. Frank, the head of the family, gets angry very quickly about any issue. He has no tolerance for the slightest disagreement. Frank has always had controlling behaviors, but recently these behaviors have intensified. He believes that others intend to harm him, so he must be alert to his surroundings at all times. After a long time of enduring Frank's unpredictable outbursts, arguments, and throwing of household items, his wife was able to convince him to see a psychiatrist. Meanwhile, as Lily, the youngest child of the family, tried not to let her voice be heard from the room, she said to her mother, "How can we persuade him to take those medications if they help him?" Mike, Lily's brother, said, "He won't accept it. He doesn't trust any of us. It's obvious he won't bear the burden of taking medications." The mother of the family, while trying to hide her hesitation, said, I'll try to talk to him." At that moment, Frank shouted from the other room, "What plan have you schemed against me again? I'm not crazy. You all are. You're the ones who should take medication because you don't understand. That doctor is insane. God knows what he's put in these pills to cause me harm." Then he slammed the door shut. John is visiting his family for a few days during the holiday. John, due to his obsessive-compulsive disorder, OCD, had reached a point where he had become so consumed by cleanliness issues that he had sought psychiatric help a month ago and started undergoing treatment. John didn't want his family to know about this issue. In his strict and religious family, cleanliness was considered a virtue, even if washing his hands hundreds of times a day made them dry and chapped. John's mother also had a cleanliness obsession since childhood. John didn't realize how abnormal and damaging these repetitive cleaning behaviors were for himself and those around him until he moved out of his parents' house. It was then that he understood he was hurting himself and others, and he felt good about finding a way to escape the constant thoughts of dirtiness and the compulsion to clean. However, he was worried that his family would discover him taking medication. He didn't know how to explain it to them. He had decided that if somehow they caught him taking the pills, he would say that he was taking vitamin or dietary supplements. But that day, when John was out of the house for a few hours to visit his childhood friend, his mother had searched through his belongings and was horrified when she saw the pills. When John returned home, his mother abruptly said, "What are you, crazy? Why are you taking these crazy pills? What has happened to you since you left?" John tried to explain, but fear had rendered him speechless. He didn't want the situation to escalate because he knew he couldn't explain to his mother why he needed these medications, and that taking medication for his condition didn't mean he was insane. John attempted several times to interrupt his mother's angry monologue, but it seemed like she couldn't hear anything. After a few minutes, he became so frustrated that he walked towards his room and firmly closed the door behind him without any explanation. He thought to himself, "Am I really crazy?" Julie, Frank, and John all require medication for their psychological problems, but each of them has encountered difficulties with treatment for different reasons. Much research has been conducted worldwide on the reasons for discontinuation of medication. A group of researchers reviewed 35 studies about this topic and identified several common factors explaining why people with mental health problems stop using prescribed pills. Lack of insight. Let's consider Frank as an example. Many individuals who experience severe mental illnesses and exhibit symptoms of psychosis often lack insight into their need for help. Although specific protocols exist to educate patients and their families about the importance of medication, studies have shown that the highest likelihood of medication adherence occurs when individuals themselves have a positive attitude towards seeking help through medication. Side effects. Mental illnesses such as anxiety and depression can impose a heavy burden on a person's mental well-being. It is not unlikely that when someone experiences side effects, they find that a new problem is added to their pre-existing distress, making it difficult to tolerate this new issue and find a solution to alleviate it. Many psychiatric medications, just like medications used to treat medical conditions, can cause various side effects. Usually, medications with common side effects are initially prescribed alongside other medication that helps control those side effects. For example, stimulants like Ritalin, prescribed to enhance attention and focus in individuals with attention deficit disorder, may lead to an increase in physical anxiety symptoms such as heart palpitations and restlessness. Therefore, alongside stimulants, an anxiety-controlling medication is often prescribed, especially if the person is already suffering from anxiety issues. Each person's body is unique, and the effects and side effects of a medication may vary among individuals. Some side effects of medications resolve on their own, while in other cases they can be managed by adding another medication. And sometimes they are so bothersome that the medication needs to be completely changed. However, even if they are mild, side effects exist and can be distressing. If Julie decided not to cancel her next appointment with her psychiatrist, the psychiatrist might have gained a better understanding of her problem by assessing Julie's body's response to the medication, and could have offered better choices to address her concerns. Social stigma. Another important factor that may contribute to non-adherence to medication is the concern about social stigma and judgment from others and society. John felt labelled as crazy, a title that carries a negative connotation and implies that the person with psychological problems is not normal. This often leads to the individual with the illness isolating themselves from others. Some studies have shown that having social support, especially from family, can have a significant impact on the process of improving psychological issues. Nowadays, no one scolds a person with a cold for using medication, perhaps because the cause is identifiable and tangible. Unlike physical illnesses, mental illnesses are recognized through a set of symptoms and do not have a visible, tangible cause within the body. One reason for social stigma related to taking medication is the lack of observable cause for many psychiatric illnesses. This is despite the fact that severe mental illness can be as distressing and even life-threatening as physical illness. Sense of agency. Statements like, "I should handle it myself," reflect this attitude where medication is seen as an external solution to an unpleasant condition that questions the agency of the person consuming it. It's as if, it's not me who's getting better, but the medication is allowing me to do so. The agency of the individual is always involved in the decision to take or not take medication as a means of helping themselves. How can a medication help me if I don't choose to use it myself? The need for a sense of agency is what drives people to search for the names of medications before or after visiting a psychiatrist, seeking more information about the medication, gaining a greater sense of control, and reducing anxiety. Gaining information about the prescribed pills is everyone's right, and can be helpful in completing the treatment journey. However, this may also contain some potential risks. Imagine a person who, after experiencing a sudden breakup, begins to suffer from recurrent anxiety attacks and symptoms such as decreased concentration and low mood. This person decides to visit a psychiatrist, who prescribes them a medication called trifluoperazine. If they search for its name on Google, the first thing that catches their eye on the search results page is the statement that this medication is an antipsychotic pill used to treat psychotic disorders. They might start to wonder how bad things have become if they have developed a psychotic disorder. The point here is that traditional naming of psychiatric medications like antipsychotic or antidepressant does not necessarily correspond to their specific uses. The medication prescribed for this person is often used to manage symptoms of psychosis. However, in their case, it's prescribed to treat anxiety. Due to these complexities, understanding medications through internet searches can be challenging and even misleading. On the other hand, a psychiatrist may be better equipped to answer our questions and address any concerns we have. Fear of becoming addicted. Some people may worry about addiction and dependence on medication. Nowadays, science has advanced to be able to produce psychiatric medications with greater safety, fewer side effects, and less dependency compared to the previous century. However, there are still medications, such as benzodiazepines prescribed for sleep and anxiety issues, that can create relatively high levels of dependence. Nevertheless, if these medications are used under the guidance of a psychiatrist, gradually and with appropriate dosage, the risk of addiction for the person using them is minimized. In other words, addiction to a substance and controlled use of that substance for therapeutic purposes are two completely different matters. Therapeutic relationship. The last factor that can contribute to the effectiveness of pharmacotherapy and maintaining adherence to it is behavior and the type of relationship with the psychiatrist. Similar to psychotherapy, where any change requires a sense of security, trust, and the development of a good and constructive therapeutic relationship, a good therapeutic relationship with the psychiatrist also helps address uncertainties and foster a sense of agency, to acquire information and insight into the functioning of medication and the nature of the illness, and to address issues such as side effects and the selection of the most suitable medication for each individual's problem. Choosing to take or not to take medication and adhering to that treatment path is a decision that, above all, the individual can make based on their characteristics, circumstances, and preferences. Imagine how it could be if Julie sees her psychiatrist again and expresses her concerns about the side effects of the medication. If Frank trusts his spouse once again to go and see the psychiatrist. And if John can feel that his mother understands his need for medication and coping with his obsessions.